Central and South America have become the intense zones for COVID-19 transmission. According to the World Health Organization, the biggest rise in caseloads is now in Brazil, Colombia, Chile, Peru, Mexico, Haiti, Argentina, and Bolivia. But healthcare workers across the region say they do not have access to adequate personal protective equipment. Many of them report that to save lives, they have to risk their own. Our Latin America correspondent Nicole Fröhlich has this report from Colombia.
This is what a medical professional dealing with COVID-19 should look like. But most healthcare workers across Latin America can only dream about having access to this sort of equipment. Publicly hailed as the heroes of the pandemic, frontline healthcare workers in many countries, like here in Peru, are protesting against a lack of personal protective equipment. In Bolivia and Mexico as well, healthcare professionals have denounced what they see as systemic violations to their right to safe and healthy working conditions. We are asked to reuse our uniforms, to sew them from cloth. They want us to wash or reuse our N95 masks after several of our colleagues have become infected and even died. We want the authorities to listen. We want equipment so we can work. In Colombia, the rising worldwide demand and a decentralized, privately administrative healthcare sector have caused grave shortages. In an attempt to cash in on the crisis, medical supply stores have started popping up in the capital, Bogota. From full body suits to surgical gloves, a seemingly endless stock of much-needed equipment. But there's a catch.
Even though protective gear can be purchased quite easily here in Colombia, adequate masks are expensive and often fake, like this one. But for many medical professionals, entering this dangerous bargain is the only shot they have at finding at least some kind of protection.
Mariana treats COVID patients in Bogota. To protect her little son from the virus, she moved out of the family home 2 months ago. And to protect herself from exposure at work, she tried to take matters into her own hands. We received a private donation of N95 masks and some face shields. Then we took it upon ourselves to buy protective overalls. But we weren't allowed to use this equipment at the hospital. The administration told us that we were only authorized to use what they provided for us. At the time, that was merely a conventional mask. I was then reprimanded by my superiors. It wasn't a big deal, but it made me very sad to see that. On top of them not guaranteeing our safety, they'd cause problems when we try to take care of ourselves. Lack of protection in Colombia is especially problematic because of an idiosyncrasy in the country's healthcare system. An aggravating factor we're seeing a lot more of here in Colombia than in other countries is that healthcare workers are usually employed in more than one hospital. Between 40% and 60% of them work in 3 facilities. They travel back and forth between them, and that makes the handling of a pandemic with the kind of transmission rate we're currently seeing very difficult. To ensure protection of exposed healthcare workers, a judge in Colombia recently ruled in favor of a group of doctors who sued the health ministry. Now, all hospitals are obliged to provide adequate equipment for their staff. But for the over 1,000 medical professionals in the country who have already contracted the virus, that decision comes too late.
That report from DW's Nicole Fröhlich. She's now back in Germany and joins us for more on this story. Hi, Nicole. We just saw there that a hospital staff in Colombia need to actually procure their own protective equipment. Why isn't medical-grade equipment being provided for them by their places of work?
Hi, Sumi. Well, while in many countries across Latin America that can be attributed to a lack of emergency funding or administrative gridlock, the case in Colombia is a little different because even public hospitals are being administrated by private companies, and these privately run entities just can't compete in the bidding war that's going on across the globe right now. Some 94% of these companies are saying that they're having problems purchasing PPE, especially those much talked about N95 masks. the Colombian government has promised to step in. They have allocated some 5.6 million euros for protective equipment for hospital staff in the country, but that's not nearly enough. According to the Colombian Medical Association, 103 million euros would be needed to provide adequate protection for all hospital workers, and that includes not only doctors and nurses, but also janitors and cleaning personnel, all those people who are constantly exposed to a highly contaminated environment.
And some healthcare workers are speaking up about these shortages and facing consequences for it. Even someone you spoke to. Tell us more about that.
Yeah, Mariana Morales, the nurse that we spoke to for this report, who publicly spoke out about the lack of protective equipment at her hospital, was forced to leave her job shortly after she spoke to us. She told me that it wasn't directly related to the interview she gave me, but that it definitely had something to do with her being perceived as a troublemaker for calling out these shortcomings. And that's something that we're seeing very often across the Western Hemisphere. A case to point out would be Nicaragua, for example, where the government has played an active role in downplaying the significance of COVID-19, where healthcare professionals are reporting that they're being harassed and even fired for bringing their own equipment to work, and thus somehow recognizing that there is actually a threat, or even speaking about the virus, not even critically about the handling of the government or the institutions they work for. So that just really goes to show how important it is to ensure freedom of speech for healthcare professionals during these times, not only to call out shortcomings of their own institutions, but also to sort of educate the public about the significance of this virus when their governments fail to do so.
And it comes as the WHO now says it considers Central and South America hotspots for transmission of the coronavirus. So why are we seeing a spike in cases in that part of the world?
Exactly. The Americas, which of course include the US, are now home to 5 of the 10 countries that have seen most new infections in the past days, just the caseload is rising rapidly. In a lot of countries in Latin America, that can be attributed to especially one thing. There's a high level of informality, and a lot of countries in the Caribbean and Central America and South America that have been or still are under strict lockdown are now kind of forced to ease restrictions to keep the economy from collapsing and get people back to work so they can earn a living. So with more people out on the street, of course, the infection rate tends to rise. But we're also seeing a spike because a lot of countries are now testing more than before. Many countries across Latin America have spent the past weeks and months ramping up their testing capacities, and if there's more tests being done, of course, there will be more positive cases. The focus now lies on vulnerable regions like the Amazon and countries like Haiti with already very precarious healthcare infrastructures that tend or threaten to collapse under a major outbreak, Sumi.
All right, DW's Nicole Fröhlich reporting for us. Thank you. Well, let's take a look at the latest developments in the coronavirus pandemic. The United Nations and Saudi Arabia are hosting a pledging conference to raise money for war-ravaged Yemen. The aim is to raise some $2.4 billion to support a population hit hard by malnutrition and now the coronavirus. Pakistan's Prime Minister Imran Khan defended his decision to lift most lockdown measures, citing huge economic losses. He said if people take precautions, it is possible to live with the virus. The UK's plan to introduce a 14-day quarantine for people arriving from abroad is being criticized, with concerns that it may have a limited impact on public health. And in New Zealand, Prime Minister Jacinda Ardern said her government will consider relaxing all restrictions sooner than planned as the country's fight against the virus is progressing ahead of schedule.